My name is Areeb Ahmed, and today I'm going to be presenting my oral competency exam of the skeletal system bones for my Anatomy Physiology 1 class. Starting with the skull, we have the frontal bone, we have the parietal bone, we have the occipital bone, we have the temporal bone, we have the sphenoid bone, we have the zygomatic bone, we have the mandible, we have the maxilla, that's the ethmoid bone, and that's the lacrimal bone. And this right here is the palatine bone. And if you look at it from the front view, these are the nasal bones. This is the inferior nasal conchae, and this is the vomer. Focusing on the throat bone, we have the hyoid bone right here. Going to the shoulder bones, we have the clavicles and the scapula. Going to the chest bone, we have the sternum and the ribs. Going to the vertebral bones, we have the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae, the sacral vertebrae, and the coccygeal vertebrae. And these are the hip bones right here. This is the ilium, that's the pubis, and that's the ischium. For the arm bone, we have the humerus, that's the ulna, and that's the radius. And if you look at the leg bone, we have the femur, the patella, the tibia, and the fibula. Going to the foot bones, we have the calcaneus, talus. This is the cuboid bone. This is the navicular bone. This is the lateral cuneiform bone. This is the intermediate cuneiform bone, and that's the medial cuneiform bone. These are the metatarsals. These are the proximal phalanges, intermediate phalanges, and distal phalanges. And our last are the hand bones. So we have the scaphoid bone, the lunate bone, trachetrum bone, pisiform bone, hamate bone, capitate bone, trapezoid bone, trapezium bone, metacarpal bones, proximal phalanges, intermediate phalanges, and distal phalanges. And this concludes my oral competency exam. Thank you.